Hi everyone, I am Roslyn Anita, nursing tutor in Tribhuvan College of Nursing. Today I discuss about techniques of physical examination. Objectives, introduction, techniques used in physical examination, what is inspection, enlist the general inspection, list the principles and techniques of inspections, what is palpation, list the principles and techniques of palpation, mention the types of palpation, what is percussion, types of percussion and percussion sounds, what is auscultation, list the sounds and techniques of auscultation, mention the manipulation. Introduction. A comprehensive 8 to 2 assessment is done on patient admission or in the community center, and when it is determined to be necessary by the patient's health status. The head to toe assessment includes all the body systems, and the findings will inform the healthcare professional on the patient's overall condition. Physical assessment is an important part of the nursing process because it provides the data for which a nurse can make a nursing diagnosis and plan, implement and evaluate the nursing care. Coming to techniques of physical examination. The four basic techniques used in physical examination. One is inspection, second one is palpation, third is percussion, fourth is auscultation, and manipulation also important techniques for other techniques used in physical examination. Inspection. Inspection is the systemic visual examination of the client, or it is the process of performing deliberate, purposeful observation in a systemic manner. It involves observation of the color, shape, size, symmetry, position, and movements. It also uses the sense of smell to detect odor and sense of hearing to detect sounds. Inspection can be combined with the other assessment techniques. Coming to general inspection. Overall appearances of health or illness, signs of distress, facial expression and mood, body size, grooming and personal hygiene. Coming to principles of inspections. Good lighting, either daylight or artificial light, is suitable. Expose body parts being observed and look before touching. Warm room for examination of the client, not cold, not hot. Observe for color, size, location, texture, symmetry, odors, and sounds. Compare each area inspected with the opposite side of the body if possible. Use pen light to inspect body cavity. Techniques. Expose body parts being observed while keeping the rest of the client properly draped. Always look before touching. Use good lighting. Tangential sunlight is best. Be alert for the effect of bluish, red tinted or fluorescent lighting that interferes with observing the bruceous cyanosis and erythema. Observe for color, size, location, texture, symmetry, order, and sounds. Coming to palpation. Palpation, it is an assessment technique which uses sense of touch. It is a feeling the body or a part with hands to note the size and position of the organs. The rosum, back surface of the hand, and fingers are used to measure temperature. The palmar, front surface of the fingers, and fingers pads are used to assess texture, shape, fluid, size, consistency, and pulsation. Vibration is palpated best with the palm of the hand. Coming to the principles of palpation. Examiner fingernails should be short. Use sensitive part of the hand. Light palpation precedes deep palpation. Starts with light, then deep palpation. Tender area or palpated last. Tell the client to take slow, deep breaths to enhance the muscle relaxation. Examine the condition of the abdomen organs. Depress the area must be approximately 2 cm. Assess the turgor of the skin measured by lightly grasping the body part with fingertips. Coming to techniques. Examiner fingernail should be short. The most sensitive part of the hand should be used to detect the various sensations. Light palpation precedes deep palpation. The tender area or palpated last. 3 different types of palpation can be used depending on the purpose of the exam. Coming to the types of palpation, light palpation, deep palpation and bimanual palpation. Coming to the percussion. Percussion. It is the examination by tapping the fingers on the body to determine the condition of the internal organs by the sounds that are produced. Percussion is the act of striking one object against another to produce the sounds. The sound waves produced by striking action over body tissues are known as percussion tones or percussion notes. Percussion is also used to determine if a structure is air filled, fluid filled or solid. Coming to the types of percussion, direct method involve striking the body surface directly with 1 or 2 fingers. Coming to the indirect method, performed by placing the middle finger of the examiner non-dominant hand, pleximeter hand firmly against the body surface with palms and fingers remaining off the skin and the tip of the middle finger of the dominant hand. Flexor strikes the base of the digital joint of the pleximeter. Use a quick and sharp stroke. Fist percussion. The techniques of direct fist percussions, the techniques of indirect fist percussions. Percussion sounds. Sounds, intensity, pitch, duration and sources. Resonance, moderate to loud, low pitch, long duration, normal lung. And coming to the sound tympani, intensity is loud, pitch is high, duration is moderate, sources is gastric air bubble. Coming to the sound of dullness, soft to moderate intensity, medium pitch, moderate duration, sources is liver. And sound hyper resonance, intensity is very loud, pitch is very low, duration is very long and sources is hyperinflated lung. Coming to the sound flatness, intensity is soft, pitch is high, duration is short and sources is muscle. Coming to the auscultation. Auscultation is the process of listening to the sounds that are generated within the body. Auscultation is usually done with stethoscope. The heart and blood vessels are auscultated for circulation of the blood. The lungs are auscultated for moving air, breath sounds. The abdomen is auscultated for movement of gastrointestinal contents, that is bowel sounds. Characteristic of sounds. Pitch ranging from high to low, loudness ranging from soft to loud, quality gurgling, duration is short, medium or long. Coming to the techniques, snuff fitting earplugs, tubing not longer than 15 inches and internal diameter not greater than 1 inches, diaphragm and bell. Coming to manipulation. Manipulation is a moving of a part of the body to note its fixability. Limitation of the movement is discovered by this movement. Testing of reflexes. The response of the tissues to external stimuli is tested by means of percussion amber, safety pin, wisp of cotton or hot and cold water. Coming to the conclusion, Physical examination is important for everyone. It is assessment in which we judge the physical quality of the person. It is an examination in which we detect a disease in the person who look and feel well by taking in physical exam. The techniques of assessment involves inspection, palpation, percussion and auscultation. The physical examination is a key part of continuum that extends from the history of the present illness to the therapeutic outcome. If the history and physical examination are linked properly by the physician, reasoning capabilities, laboratory test should be the large measure by confirmatory. References is Potter and Perry Fundamental of Nursing, 9th edition, page 105 to 110. And we are referring the physical examination, health assessment in the net, and method of physical examination in the slide share. Thank you.